Henry Ford Jackson Hospital and IEP. We have Administrative Program Director for the Hospitalist Group, Caitlin Riccardi, and Nurse Practitioner and the lead for Advanced Practice Providers, Joe Yaksik. Welcome to our show.
Thank you. It's good to be here.
Nice to see you. And Joe was telling me before the show, he's looking to move closer to Jackson. So what about that house?
That house was looking amazing. I'm going to have to save up just a little bit more before I can get into something like that. But yeah, the plan is to eventually move out in the Jackson area. As we talked about a little bit, I've been coming out to Jackson since 2013. Really love the community. I drive past a bunch of other hospitals on the way out here to work at Henry Ford Jackson, just because I like the team and the community, and be able to make such an impact out in the community really keeps me coming out. So we're looking to relocate.
Cool. Well, look forward to that, and we're glad to have you here at Henry Ford Jackson. Both of you oversee or involved with the Hospitalist system or program.
Sure.
What is a Hospitalist, Caitlin?
Sure. So a hospitalist is like your primary care physician while you're in the hospital. So think of the hospital as like their doctor's office. And when you're a patient in the hospital, you might see a lot of different providers, and a lot of different white coats might walk into your room. You might see your heart doctor, your kidney doctor, your stomach doctor, but the hospitalist is the person who takes pieces from all of these different specialties and puts it together and see the patient as the whole, and ultimately drive the duration of your hospital stay and determine when you're ready to discharge the hospital and go back home.
Nice. Now you're an administrator.
Yes.
And Joe, you are a practitioner.
Yes, that's correct.
And what do you do?
So our APP team does several things. We're involved in the observation service as well as the admissions on the inpatient side. So when you come to the hospital and you start off in the emergency department, you may have something to where we want to watch you for a little bit more versus sending you home and say, there's maybe some testing that we should do overnight, kind of keep an eye on you. You're not quite sick enough to be in the hospital completely, but we'll put you in the observation service, see a cardiologist perhaps, do some testing that normally would take several weeks to get outpatient, but we're able to do that next day, usually in the observation service. So our advanced practice providers work with our ED physicians in managing the observation. Let's say you are sick enough to be admitted to the hospital completely, where you're going to need multiple days of things. Say you come in with pneumonia, and you're going to need multiple days of antibiotics and oxygen and things like that. The first member of our team that you're going to meet is going to be an advanced practice provider, which is either a physician associate or a nurse practitioner like myself. And we'll meet you down in the emergency department, kind of get your story, verify your home medications, things like that, and come up with a plan. And then we'll go and speak to our attending physician, who is going to be coordinating all the different APPs and patients that come into the hospital. And we'll refine that plan based on input that we get from them. And they'll come around and see you. And by the time the physician sees you, they already have your story. They're very familiar with why you're here. And they have the kind of plan set up. So when they come around, it really makes an easier conversation with them.
Yeah, so there's a human handoff.
Absolutely, yep.
You're not just reading charts and guessing what might have happened downstairs.
Absolutely. And that's really the beautiful thing about our company, IEP, as a whole. You might be familiar, there's an IEP urgent care right on Michigan Avenue.
Oh, yeah, I'm a frequent customer.
Almost across from the hospital. And then the emergency department at Henry Ford Jackson are IEP physicians. And then, like I mentioned earlier, the hospitalists are also part of IEP. And then within the last year, we've also expanded into some subacute rehabs or skilled nursing facilities like Mission Point and Vista Grand. So at each step of this care plan, say you go to the urgent care and then you need to go to the ER and maybe be admitted to the hospital, at each step it's a person-to-person handoff, like you said, and it's an IEP provider to IEP provider. So we kind of call it the golden ticket, and we're all one big team caring for the patient.
The advanced practice providers consist of two job categories. One, you are a nurse practitioner, and there's also physician assistant.
Yeah.
To a patient, they're interchangeable, I think.
Sure.
But what's the difference?
So the difference is, to be a nurse practitioner, you have to first start off as a nurse. So my background, previously I was an emergency department nurse, and I worked in the ICU as well before I went off to get a master's degree. A physician associate, commonly known as physician assistant, they've recently changed to be physician associate, so you'll hear both terms getting thrown around. They also have a master's degree. You can have either a master's degree or a doctoral degree to be an advanced practice provider. And we function very much in the same capacity and same roles. It's just our path to get there is just a little bit different.
And I think when someone is seeing either a nurse practitioner or a physician's assistant, I guess the feeling is that you're just like a doctor. I mean, there's a lot of things that you can do in place of a doctor or to assist a doctor.
Right, and we work hand in hand with our physician colleagues. There's things that we know, and there's things that we know when we're kind of pushing our limit. And that's what's great about our team is that we have our attending physicians are there for any things that we come across that we might not be familiar with, or something that we might not pick up on. They're there to help us. And it's really a collegial relationship, and it works very well.
And I think where I would see what you do very important is when it's time to leave at discharge. There's all these papers and instructions, and a lot to remember. What's the role of your department in the time of discharge?
Sure. So I really should take this opportunity to brag about a wonderful group of ladies that I have the honor of working with every day called the We Care team. And what members of the We Care team do is they partner very closely with our hospitalist physicians, and they coordinate your care, particularly all of the care that you'll need when you leave the hospital. So they'll make sure all of your important follow-up visits are scheduled and printed out on your discharge paperwork for you, so it's very convenient. They'll also make sure your primary care physician is aware of your hospital stay and that they have all of the information that they need. And if you don't have a primary care physician, they are happy to help get you set up with a new patient appointment. And really so many other things, all of the administrative and clerical tasks related to your hospital stay, they can take care of for you. And what this does is it really frees up our providers' time to spend more time with the patient doing what they do best, and that's getting our patients feeling better sooner.
It's, I know, a goal to provide an experience, a positive experience, even though you're in the hospital. It's one of the things that people look at hospitals on how they care for the people, how their patients experience the service and the care. So that sounds like having a team. We Care, what do you call them?
The We Care team.
The We Care team,
Yes.
There you go, you have a We Care team. You mentioned people would have a heart doctor, they'd have a stomach doctor, but as a hospitalist, you're a generalist, and as an APP, you've got to know a lot about a lot of things. What, for you, is the most rewarding part of being a nurse practitioner, Joe?
Just the interacting with the people, coming out and being able to make a difference in somebody's life when they come to see us, they're not feeling the greatest, they're not having the best time. So if I can provide that care to help get them on the path of feeling better. Usually when I see people, they've been in the ER for a couple hours, and my first question is, how are you feeling now? Have the things that we've done for you helped you a little bit? Are you feeling better? Is there anything else that we need to do to kind of get you on the path of feeling better? Because we really care. We want people to come in, feel better, and the goal is to get them better and be able to get them home as soon as we can.
Yeah, it's the worst day of their lives, perhaps, when they're in the ER. And yeah, I think we've all been in the ER when we've seen people have a meltdown because they're in such pain, or they, one reason or another. It's just a bad time. And you, for your job,
Yeah,
what's the most
absolutely.
rewarding part of everything that you do?
Sure. So I like to say that I'm the business side of healthcare, and I'm kind of behind the scenes. And The reason I got involved in healthcare administration, I originally was thinking about going into maybe nursing school. I have such a huge passion for healthcare and helping people, and I have all the respect in the world for our frontline workers, our nurses, and our physicians. But personally, I'm one of those people who I get a little woozy getting my blood drawn, so I thought, okay, maybe clinical care isn't the right route for me. And then I heard about the healthcare administration field, and I got involved, and I haven't looked back. And I look at my role, even though I'm not the frontline worker caring for the patient, I'm doing my job the best that I can so that the physicians and APPs can do their jobs the best they can, which also kind of aligns with one of our company's mottos, and that's taking care of our patients by taking care of the providers.
And you both still get the employee discount in the cafeteria.
I think you get free coffee, Joe.
I do get the coffee, yes.
Well, it's great knowing more about the care that we're getting when we're in the hospital. Thanks for all that you guys do.
Yeah, thanks for having us and letting us talk about what we do.
Yeah, appreciate it. Nice to meet you both. Caitlin Riccardi is Administrative Program Director for the Hospitalist Group for IEP. And Joe Yaksik is Nurse Practitioner and Lead for the Advanced Practice Providers, all at Henry Ford Jackson Hospital. Some birthdays